Tobramycin is made semi-synthetically from kanamycin. Tobramycin linking to the hydroxyl at carbon 3, and it is not substrate for APH3 1 and 2, so has a broader spectrum from than kanamycin. It's widely used parenterally for difficult infectious, especially to those gentamicin resistance infection or Pseudomonas aeruginosa. And tobramycin is available for inhalation for treatment of Pseudomonas aeruginosa infection in cystic fibrosis patient, and this route of administration results significantly reduce their toxicity. Now the neomycin, as we in this structure we have two types, neomycin B and C. The differences between them is just in the functional group at R1 and R2, in which R1 CH2NH2 and the R2H is called neomycin B, and if the R1 is H and R2 is CH2NH2 is called neomycin C. Neomycin is considered for the most useful antibiotic for the treatment of GI infection, dermatological infection, and acute bacterial peritonitis. It is not absorbed from gut and orally does not produce any systemic toxic effect, but suppress the gut flora in preparation for bowel surgery. As ointment used topically for treatment bacterial skin infection, so when it's applied on the skin, the drug is not absorbed but applied to the large denuded areas. Systemic absorption occur with the potential to cause toxic side effect. Spectinomycin, it is a bacteriostatic agent used with a single bolus dose for an IM injection against Neisseria gonorrhea in case of urogenital or oral gonorrhea. It does not apparently produce any serious auto or nephrotoxicity when used in this way. It's particularly useful in treatment of patients with allergic to penicillin. Now, lincomycins or lincozaminide. Lincomycins contain unusual 8 carbon sugar, a thiomethyl amino octoside or thiolincosamide linked by an amide bond to an inappropriate substituted N-methyl pyrrolidyl carboxylic acid. They are weakly basic from and form clinically useful uh, hydrochloric salt. Lincomycin resemble macrolide in antibacterial spectrum and biochemical mechanism of action and bacterial resistance. They bind to the 15S ribosomal subunit to inhibit the protein synthesis, as we see in this figure. Its action may be bacteriostatic or bactericidal depending on the various factors, including the concentration of antibiotic. Firstly, they undergo extensive liver metabolism, resulting primarily in N-demethylation and N-dismethyl analog retain biological activity. They are associated with GI compliance like nausea, vomiting, cramps, and drug-related diarrhea. The most severe of these is pseudomembranous colitis. Lincomycin is a natural product active against gram-positive organisms, includes some anaerobics. It's well absorbed orally and distributed widely in the tissues. It is generally reserved for penicillin allergic patients due to the increased risk of pseudomembranous colitis, and it served as a starting material for the synthesis of clindamycin by an SN2 reaction that inverts the stereochemistry of C7 ROH to C7S chlor. Clindamycin, and we see the lincomycin structure and the clindamycin. So this is substitution of the chloride for the hydroxyl group consequently make the clindamycin more bioactive and lipophilic than the lincomycin. Thus, it's better absorbed following oral administration with higher tissue level, and it's work well for a gram-positive coccal infection, especially in patients that allergic to the beta-lactam and has better activity against anaerobic. Clindamycin has excellent activity against Propionibacterium acne, when applied topically, it is a common topical treatment for acne. Clindamycin palmitate, and we have clindamycin phosphate. The clindamycin palmitate is very water insoluble, tasteless palmitate HCl product for clindamycin, so it's linked to the better taste. While the clindamycin phosphate is very water soluble phosphate product of clindamycin, and it is exists as zwitter ionic structure that is very soluble in water, and it is intended for parenteral uh, administration for treatment serious infection and instance uh, when oral administration is not feasible.